Well, today families from all 50 states are gathering on Capitol Hill to call for better care and programs for babies. The event is called Strolling Thunder. It's organized by 0 to 3, which advocates for quality and affordable care for babies and toddlers in America. 0 to 3 Chief Policy Officer Myra Jones-Taylor joins us now. Hey, Myra, thank you so much for joining us. What do you hope to accomplish today with this walk?
So today we brought families from all 50 states and the District of Columbia to make sure that Congress thinks babies. We want to make sure that every child's potential is our national priority. And so we have 3 key asks, if you will. The first is to make sure that we have a national paid family and medical leave program for families so that parents have time to bond with their children after a birth or the adoption of a child, or if a child is sick, that a parent doesn't have to decide between going to work and staying by that child's bedside in the hospital. The second is to increase access to high-quality, affordable child care. We know that child care costs are often the biggest line item in a family's budget, and we know that's not good for families and it's not good for children. And third, we want to make sure that we increase investments for Early Head Start. That program is a game changer for so many children, but unfortunately we don't have enough resources for all eligible children to take part in it.
What direct action do you want lawmakers to make at this point?
So, we had great success last year this year with the omnibus. We had an increase of $2.37 billion for child care. That is a down payment. We want to see more of that. We know that's a huge amount of money, but it's still not all children who are eligible are receiving that support. So that's a big one. We have families who are out there, on the Hill, speaking directly with their members to let them know their stories. We have the science here at 0 to 3, but families know what their children need. And so together, we're making sure that they understand this is a national priority. It's a bipartisan issue. We have support from the business community for our asks, and we have support from the American people. So we're building the momentum and making sure that Congress knows to think babies.
First Lady Melania Trump revealed the Be Best program yesterday. It's aimed at improving social, emotional, and physical health of children. Do you think that this is really a step in the right direction?
So we support the programs and the supports for young children and their social and emotional well-being. We do a lot in the space of infant, early childhood mental health. We know that young children, they have these brains that are developing quicker than between the ages of 0 to 3 than at any later time in life. And so we want to make sure that all those synapses, that we have 1 million new neural connections that are forming every second in a baby's brain. And we know that the strength of those connections are dependent on many things that will then lead to strong social outcomes. They'll lead to the social and emotional well-being of children. So we certainly support folks who want to advocate and support young children's social emotional well-being. So we've been fighting for that for over 40 years at 0 to 3 and want to see more support for infant early childhood mental health.
Yeah, Myra, I don't think it was until I became a mom I realized just how important those early birth to 3 years really are in a child's development. I'm so grateful you could join us. Myra Jones-Taylor, thank you very much.
Thank you.